I guess, Sarah, would you like me to kind of go over the overview first?
Sure.
Okay. I was like, wait, who's speaking? I guess I'll start off with a little bit about how we came about. Our organization actually started because my daughter, Taylor Nearon, actually had a mast cell disease. And she's the founder and creator of, um, sorry, of our nonprofit. And literally, we were coming home from our appointment with Dr. Afrin out in Minnesota. And she said, Mom, this isn't fair. We need to help out other patients. And essentially, we are a nonprofit organization that provides financial resources to patients. To date, we've been able to provide over $120,000 in grants to patients. We do not ask how you use it. Our intent is that it's to help you offset living and medical expenses. We also send out a lot of resource material. And Stephanie can, she can share and show with everyone, one of the things that I'm going to touch upon this evening is from a caregiver's perspective, because I have to be honest, until never heard of a mast cell disease. And I didn't know that I had a voice as an advocate. And that all came about because being a caregiver, seeing how our healthcare system treated patients, especially my daughter, as a caregiver, I learned quickly how to find my voice and how to stand up. A lot of times we tend to be a little apprehensive and we think because they're a physician that it's what they say is golden, but then you're sitting there and you leave an appointment and you feel like, okay, what just happened? I didn't get answers. We still feel kind of lost. At the end of the day, there should be a team approach. It shouldn't be, doctors being dismissive. If they don't know something, let's get some answers. And that's kind of how this all came about. We created a system that worked for us, and I've been able to help other patients and their caregivers. The biggest piece of advice I would have is, start with a notebook, start documenting symptoms. As a caregiver, I felt that was important. When certain nuances would occur, by being able to have it written down in documentation, that allowed us to be able to go back and really kind of start chronologizing everything that's going on. Am I supposed to hit something on the screen or? Oh, okay. Sorry about that. So again, having that notebook really and photos to go along really helped as we were navigating and trying to show providers, because a lot of times they would say, oh, this is in your head. And we would explain there's a physiological presentation going on. You in my daughter's case, she would get mosquito bites and she was going anaphylactic. My friend is the president of the hospital, and they couldn't believe they never in the entire time ever saw a patient that was going anaphylactic from mosquito bites. She would get huge welds from one bite that would just trickle and follow the bloodstream, the bloodline. And then she would end up going full blown anaphylactic with, asthma presentation, everything. They never saw something like that. So being able to have documentation was very useful. And we just kind of built from there. As again, from a caregiver standpoint, we kind of prepared kits from this essence that it was a hospital kit. So that when we knew that Taylor was going to be in the hospital, we had signs already made up to put on the hospital door. No sense. This meant, fabric softener on the nurses' uniforms. This meant chemicals being used in the room to be cleaned. Certain hand soaps, hand sanitizers. So by having all that information on the door, eventually she was always on the same floor. They actually copied it and they had it at the nurses' station. So that was something that eventually residually, started helping. From a caregiver standpoint, I stress all the time to caregivers, if something doesn't seem right, you need to voice your concern, your questions, and get answers. If something doesn't sit right with you, ask for an explanation, ask for it to be explained. It's the only way you're going to learn. And it really has to be a team approach. If you're not comfortable with the physician you're with or the provider, you've got to search. And that's kind of what set us on our trajectory, is that we weren't just settled. If something didn't seem right, or if there was a doctor not willing to listen out or even consult with Dr. Afrin, then it wasn't worth our time. Then you're putting my daughter's health in danger. So coordination of care is key. And that's something that I stress all the time. Um, I didn't know how much more you want me to go in, Sarah, or Stephanie. Did I go over, do I still have more time, or?
Yeah, you can keep
Okay.
going.
I didn't want to impede on time.
Yeah.
The other thing, as a caregiver, I think it's important to create that village. And when I say a village, not only does the patient need that village, but you need that. You need a support system. And, being able to have somebody maybe walk your dog if that you can't get out to do that, having somebody to help you with that, doing grocery shopping, having time just so that you can remove yourself from having that thinking cap on, from being in a caregiver role all the time, because you can get burnt out. And if you're burnt out, how are you going to be able to provide that optimal care for the patient who, as we all know, patients with a mast cell disease require a great deal of attention if, they have an in-depth situation, as in my daughter's case. And again, I'm just speaking from my daughter's case. So we really did create a village for me and a village for Taylor. And one of the rules that Taylor had set up with her friends is that it was 5 minutes of medical talk. That's it. When they would get together, it would be like, you can ask me what you want, what's going on, medications, all of that. And then after that, they literally set a timer. And when that timer went off, there was no more medical talk. It was, let's talk about life. Let's talk about everything else, so that she didn't want to be identified with with whatever was going on, the condition. If it was her POTS that day, or gastroparesis, or diabetes, there's so much more to her than that. Another suggestion I have is, when patients are struggling, I recommend that they do a spider, and this was like one of our arsenals. We had put Taylor's name in a bubble, and I made her draw lines out of who she was. And it wasn't, you could put, you have mast cell or gastroparesis, college student, soccer player, trained, so that when she was having a down day, it wasn't just mast cell. She could see she was so much more than that. And just recently, there was a patient that reached out, and they just kind of felt like this disease was dictating who they were. And I had suggested that they do that. And it really helped them to think that there were so much more than the disease. The disease isn't taking over, and that there were so many more aspects to their life. And they kind of put it in a frame. And so when they're not having a good day, they're able to look at that. So those are techniques that I think are important, because being a caregiver of any chronic illness is exhaustive, and you're always trying to think, what can you do better for the next time, and make your patient, your loved one's course of action a little bit transition better. And you got to take care of yourself, which is hard. I'll be honest, as a mom, it was hard for me to even think, I just wanted to always take care of Taylor. But then I saw the benefits of being able to step away, even if it was to just go for a walk or get a coffee, and then being able to trust people, make sure that they're educated, that are able to be with, your loved one, that they understand, and they may understand, but are they comfortable? So before you're willing to leave, in my case, another recommendation, I had them kind of shadow for a little bit, so that they were comfortable. So if they saw a seizure, they didn't panic, that they knew what to do. And again, I'm speaking from my perspective. So that's who we are as an organization. We try to, we want to be there as a support for patients. We want to be there as a support for caregivers. We receive emails and messages all the time of, what do you recommend? We will never tell you what doctors to see, what medications to take, because as we all know, this is a disease that impacts everyone individually. We are, as an organization, here to support in all other aspects. And, we always have opportunities where people want to volunteer. We're going to be putting out a shout out for that. We have different opportunities. Again, we just want to be a support system for patients that are dealing with any level of a mast cell disease. So I hope any of that information that I provided of how this disease impacted our family and how we kind of turned it around and been able to create a couple little techniques.
Thank you very much for joining us today. And Super Teas has an awesome Instagram, and they have is it every Wednesday or every few Wednesdays? They have a talk not just about mast cell, but about other related conditions as well.
Yeah, we try and do Instagram Wisdom Wednesdays at least once a month. We've been off a little bit. We generally try if it's really not just mast cell, it's really kind of any condition that's, it's a mast cell, a mast cell patient that has any comorbidity. It's really about raising awareness. We like patients to have a springboard. This evening, we actually had Summer Ladon on, the author of Canary in a Bubble. So she was able to share about her story and what made her write the book. And so, yeah, we try and get everyone involved.
I actually had a question texted to me, and Sarah, if you want to answer this question, are POTS and Mast Cell Activation Syndrome comorbidities?
Yes, definitely. I don't remember the exact statistic, but if you have POTS, you're 3 or 4 times more likely to have mast cell activation syndrome.
Yes.
Yeah, I kind of jumping in, but there's something called the trifecta, and people have a mast cell disease, some form of dysautonomia, and Ehlers-Danlos syndrome, which I'm not sure if you guys have touched base on any of
Not
that.
yet. February.
Gotcha.
February for
So-
Ehlers-Danlos, but we have covered POTS.
Okay, so if she or they wanted to look into that, and I think when you start researching a mast cell disease or even dysautonomia, I would say from when I first started like experiencing symptoms and such, that there's a lot, like once you hear about one, you start to learn about the others. So
Yeah.
EDS is on there too.
Yes.
And the fourth that's sometimes put in there too is gastroparesis.
Reese's. Yep.
Unless we have any more questions, we will move on to Emma.
Thank you, everyone.
Thank you very much, Tammy.
No worries.
All right. Hi, everyone. I'm Emma. I am 22 years old and I live in Wisconsin, just over the border, about an hour from Chicago. My grandma actually went to Loyola, so she would be super geeked when or if and when I tell her that I'm doing this with you all, because she went there. Anyways, I have a mast cell disease. I'm just going to kind of talk about my story and how I live with this condition, and navigate chronic illnesses as a whole, whilst still maintaining a not normal, but, active lifestyle, I guess you could say. I started experiencing symptoms when I was probably 12 or 13 years old. My family has a history of stomach problems and heart issues. So when I started having tummy aches, as I would say when I was a kid, and feeling not right, we just kind of pushed it off to it was probably just something along what my family went through. When things started to get worse and kind of progress for me, and I kind of knew something more was going on, was when every morning when I would wake up, my face would be swollen. And that was my first tell that, like, hey, something's not right. So I would experience angioedema, otherwise known as swelling of my lips, my cheek, my throat. And that obviously raised a red flag because I wasn't eating, I wasn't drinking. The things you think of right away are, oh, maybe something in your makeup, or maybe something in the laundry detergent. Those are kind of like what I thought was going on, maybe just something weird, and then I thought it would go away. And boy, was I wrong, because it's still here. But after going to Children's Hospital of Wisconsin, the Mayo Clinic, and now I'm a patient at Northwestern in Chicago, when I was about, I would say 14, at Children's, they said, you probably have a mast cell disease, but a lot of people are diagnosed with that, so we don't want to just like throw a label on you. So it was kind of up in the air for me for a while. And when I was a kid and I was trying to explain to people what was happening, or even understand it myself, when there wasn't a concrete name to go with it, it was difficult. And this is something people with mast cell diseases face a lot, is you're kind of in this limbo land of, hey, you might have this diagnosis, or no, you don't, or certain doctors might not agree with each other. When I got to the Mayo Clinic, I have a GI doctor who is certain that I have mastocytosis, which is too many mast cells in the body, as opposed to inappropriately reacting. And I have one doctor who's certain that it's a mast cell activation syndrome. So that is a part of being a patient that is really difficult, is the diagnostic criteria is almost non-existent. And there's so much of a variety of what people can experience when they're living with a mast cell disease. For me, it started with every time I slept, my face would swell and I would go into anaphylaxis. That's not normal. And then for me, it progressed to foods I was eating, things I was smelling, for example, cinnamon or peanuts. It just kept progressing onto different things. And that's difficult for doctors and physicians to understand, because it doesn't fit in a textbook. There is no one, there's no two patients that are exactly the same. There are common like themes, you could say, of what people experience, but no two people are the same. It's like a spectrum of what one person may experience and what someone else might deal with. So as I was growing up, I was growing up with this, and I knew nothing different than this, because it was such a young age that I started having difficulties. And I think that was to part of my advantage, that I did know a life before this, but I was still pretty young to where I could learn how to live with it and navigate it, even though I'm not sure that I have figured it out completely, or if anyone ever will, when you're living with a chronic illness. But after so many doctor visits and so many treatments not working for me, a lot of typical treatment like H1 and H2 blockers that you might have talked about in your past sessions, a lot of those things I didn't respond to. A lot of times I would take medicines and nothing would change, or I wouldn't absorb it, so I wasn't getting any effect from it. I, for a long time, struggled to find something that would actually help me and make a difference. With mast cell patients, sometimes too many medications or different medications interacting with each other can also cause harm or trouble. It's really a difficult disease to navigate, because you never know what could be playing a factor into something. And that for me was challenging. There were so many components that were causing me to be ill, but how do you pinpoint it? And I think that's something that a lot of mast cell patients deal with. Is it stress? If you're a female, is it your hormone cycle? Is it the weather? Is it getting a normal virus on top of everything that you're going through? There's so many factors that can go into um, what's going on, and you might not be able to pinpoint it exactly. For me, when I was dealing with symptoms and really things were out of control, um, I had to start from the bottom, from the ground, and build my way up. At one point, I had lost all foods. I was a senior in high school. Um, I couldn't eat anything without reacting, to a point where I would vomit every meal, and have reactions to every meal that I was having. I had lost 60 pounds in about 5 months, I believe. And I had a feeding tube placed. At the time, it was an NG tube. So, for those of you who may not know, it's a nasal gastric tube that goes in your nose and down into your stomach. And I received specialty formula to help give me nutrients. And I really saw improvement when I did this. My mast cell disease completely changed, um, because my body was essentially taken away from all the things that were causing reactions, whether that was like pizza or dairy or gluten, soy, all those different things my body no longer was fighting and interacting with. Again, it's difficult. You're 15, 16, 17 years old and you have a tube hanging out your nose. It's kind of like not the hottest thing. You're trying to go on dates and you got a tube hanging out your nose, and or just, you're trying to navigate living life, and you have this now visibility to your invisible illness, which we all wish for. We all want to be seen and we all want to be heard, but for me it was difficult. I do have I don't know if it's just the way that I cope, but quickly I learned how to adjust to it. But for a lot of mast cell patients, that is something that they deal with medical devices and them being present, and how that affects their care, how that affects going to other doctors, um, how they view themselves. Um, so it's challenging to understand all the complexities of what a mast cell disease can look like, because for what happened to me is different than what happened to Tammy's daughter Taylor, or what happens to other people. And I think that's why doctors have such a hard time diagnosing or recognizing what this condition is, because it's not like, um, let's say it's not like an arrhythmia. You go into the doctor's office, they can see it on a test and they diagnose it. Um, with a mast cell disease or any other comorbid conditions, no two people look the same. But after years and years of navigating and everything I tried, from medications to switching providers, for me, a big trigger was my hormones. I went into medical menopause when I was 16 to help with my um, reactions to my estrogen and progesterone, which is pretty common with mast cell patients. Or to now I have a service dog and he's the light of my life. But there's a lot that goes into someone's story and to my story. Probably couldn't even wrap it up in a day's worth time, if I tried, because so much has happened. And when you live in this constant trauma, and that's what it is when someone's experiencing a mast cell disease, it's a medical trauma, and not just for the patient, but for the support system too. And I think it's important to note that when patients are going through either searching for a diagnosis or living with a condition, it's most definitely not just happening to the patient. It's putting the stress on a caregiver or siblings or school, whether that's teachers. It really affects more than just one person. And a lot of times that's also because so much of what other people do affects what happens to a mast cell person or a person with mast cell disease. Whether that's a teacher who can no longer eat peanut butter granola bars because if they have a student in their class who has a mast cell disease, it can cause problems. So while it affects patients, it really makes an impact on so many other people, physicians, nurses, just like I would say emergency room departments. I've been there way more times than I can count. Um, totally on like a first name basis. I should probably have my own parking spot there. But it really does affect a community as a whole. In Dr. Afrin's book, if you don't know who Dr. Afrin is, he's one of the leading mast cell specialists, and he wrote a book about mast cell diseases, and in it he mentions that 17% of the population is led to believe to have a mast cell disease. And most of you are probably thinking, like, how can that be? I've never heard of this before. Or maybe you have it and you feel like you're alone. How can so many people have it? And I believe it's because it's such a variety and there's such a range of symptoms and levels, I guess you could say. So severity, whether a patient just needs to take Benadryl at night to prevent congestion, or is this person dependent on TPN and IV nutrition? So it's really a complex condition because it truly affects everyone differently, and it doesn't just affect a patient. So whether you're someone living with this, or if you're a doctor or you're a pre-med student who aims to be a doctor someday, these are the difficulties that patients live with. And for myself, I would say that I'm extremely lucky that I come from a family where they fully embraced what I was going through. We always talked about everything. Everyone was super involved. I would say pretty much anyone who knows me knows that I have chronic illnesses because I just never shut up and I want to tell everyone about it. Not in a way that I'm looking for attention, but in the way that I want life to be better for someone behind me. And it can be a difficult thing for patients to do. Not only are they living with such difficult symptoms and the stress of just normal life, but they're trying to navigate this world where it seems like everything is against you. And it's truly hard. So even if you're a friend of someone, or you might know someone, or maybe down the line you have a patient with this condition, or you're researching it, I think it's really important to remember that the impact of this invisible illness goes beyond the patient themselves. And I try to remember that too. And it's difficult because sometimes you just like get in your head and you want to just say like, this is just happening to me. You get grouchy and you throw a pity party, and it's totally okay and understandable why that happens. But it's also important to know that this condition, or these conditions, affect so much more. And that's why it's so important to be aware and understanding of what's going on. And I think that that's why I have become so involved with the mast cell disease community, is because I see how much it affects other people. Even even if we're not talking about my story, I've just met people in my town or near me or online, and I've seen the impact that it's made on them. So that's kind of my advice to you, and what my story is living with this mast cell disease, but also trying to take control of what I can control. So that's what I have for you. If anyone wants to talk about it or feels like they need someone to talk to, because maybe talking to your professor or talking to your family might seem overwhelming, or you don't know what to talk about, or you're just looking for a friend. I'm really active on social media. I volunteer with Super T's Mast Cell Foundation. Taylor was actually one of my friends. I also got a grant from them. Even if you don't have a mast cell disease and you're just curious about chronic illnesses, or maybe you're in the medical field and you have questions, you can message me on Instagram or friend me on Facebook, or text me or call me or FaceTime me, whatever you want to do. I'd be happy to talk about it with you all.
Yeah, Taylor, if you want to put your socials in the chat so people
Yeah.
can have access to it, that'd be great.
Yeah. And if there's anything like people have questions about, whether that's like, how did I get a service dog, or if anybody wants to talk about that more, or I was in college, I graduated, I'm a journalist now. If people want to talk about, how do I get a job, or those different things too, or whether that's, or if you want to talk about dating with a chronic illness, or any topic, I'm honestly open, and I'm sure you have questions, and you don't have to be shy. Go ahead and ask.
If anyone has any questions that they want to say out or type in the chat, go ahead. Looks like we don't have any questions, so I will start. So, in terms of mast cell disease, my got gradually worse. So at first, the only place I really noticed it was because of my POTS and because of my headaches. I would need to get IV fluids a lot, and I would always have a reaction to the adhesive that they would use for the IV adhesives. But because it didn't have visible signs, like it wasn't red or anything like that, all the doctors were like, you're fine. I was like, no, it's really itchy. And then I would, at first it would just be itchy, and then it would be painful, and then it would be pain shooting up my arm, and then it would be whole body pain. So on the right here is the one time I've had a visible symptom, and every other time I've always looked like the left here, no visible redness or swelling. So it was very frustrating to get a diagnosis because it's invisible most of the time. And the docs were like, oh, there's nothing visible, so you're fine. You guys were here for when we did POTS. I briefly talked about hyperhidronergic POTS with mast cell. It's a blessing and a curse. So if you have hyperhidronergic POTS, you have high levels of adrenaline, which is good because it can help with symptoms. And an EpiPen is just adrenaline, so it can stop anaphylaxis essentially. But then there's also, and I definitely experienced this, where there's this cyclical thing that the adrenaline makes the mast cells worse, and it keeps going in a circle. I also want to briefly talk about on Instagram, besides, there are few that are very good, but if you go like on the mast cell hashtags, there are a lot of questionable people who post that, like, I don't want to say pseudoscience, but pseudoscience kind of, and a lot of them focus on like mold, which definitely can be a mast cell trigger, but it's not the same thing exactly. And same with histamine intolerance. Definitely, a thing, but it's not the same as mast cell activation syndrome. So if you have any questions for me. If not, we'll move on to Stephanie.
So I know for those of you who've been to multiple meetings, Sarah and I have kind of like touched on us having mast cell activation syndrome at different points in time. So we're just doing rough, very summarizing our experiences. When I got diagnosed with mast cell, it was early 2019, and my prostaglandin levels were really high. So for those of you who don't know what prostaglandins are, they are involved with dealing with injury and illness. So it's like coming when like you have a lot of inflammation. So like you take like ibuprofen to lower down your inflammation and stuff like that. So with mast cell testing, you're supposed to be off of any medications that can impact your prostaglandin levels, and for like about like 2 weeks. And for those of us in constant pain, it's really hard to do that. But I did do it when I got tested. And when your prostaglandin levels are high, it means that they're reacting to like an injury or an infection. And my prostaglandin levels, your normal level is supposed to be 35 to like 115 pg per milliliter. And mine was 1,832. So I had very elevated prostaglandin levels without taking any sort of medication like ibuprofen to impact that. And that's how I got diagnosed. But as we mentioned before, you can get diagnosed with tryptase or different histidines. So that was my experience with getting diagnosed. Mast cell impacts me on mostly a daily basis. My roommate has a cat, which I am highly allergic to. So I haven't had a mast cell reaction from the cat yet, but I personally have mast cell triggers that are mostly foods and like things that I can ingest and everything, but a lot of people have mast cell symptoms that involve smells. I know Sarah has a lot more smell triggers than I do, which can be really hard to deal with because you can go out in public and you don't know what kinds of smells or things are going to be out there. And like Emma was talking about how it impacts other people too. It's like if you have friends or family that you're around a lot, maybe they can't wear their favorite perfume or deodorant or anything like that because it might cause you to go into anaphylaxis, and that's not good. So I mainly have mast cell reactions to things that I can ingest. I've only had anaphylaxis 3 times, and they've all been with medications. So even things that aren't supposed to make you react can make you react. Like one of my medicines that I reacted to was low dose naltrexone, which my POTS doctor put me on. And he's like, oh, it's only 0.5 milligrams. I've never had anyone react to this before. I was the first. So it's a wild ride. You're always finding new things that you react to. And it's kind of hard to balance everything all at once. And again, like Emma said, there's a lot of different levels of severity in terms of how people react. Unfortunately, on the lower end, I'm less severe than a lot of people that I know personally, like Sarah and Amy, and I'm very thankful for that. But and that's kind of why Sarah and I are able to start this club, because we can handle things a little better. If anyone has any questions at all, like Emma said, I'm open to talking about anything, anytime. I'm an open book for any of my medical experiences I've shared so far. But did you want me to go through the takeaways, Sarah?
Sure.
Okay, so some takeaways to take away from this meeting so you guys can get back to your normal lives. Mast cells play an important role in the function of everyone, such as the immune system and allergic reactions, and release over 200 mediators and are located throughout the entire body. So a mast cell disease is when mast cells either don't act the way they're supposed to, or you have too many of them. And mast cell activation syndrome is when the mast cells are trigger happy and can react over things they are not supposed to. And they can cause a wide variety of symptoms all over the body, from stomach pain to flushing to basically any symptom you can think of. Like Sarah said, there's well over 70 of them. And they can be caused by basically anything, which makes it very difficult to pinpoint what's causing it, when it happened, everything like that. So they're very unpredictable. Triggers can change over time as well. At one point in time, I was only able to eat 5 different foods, and now I can eat at a restaurant, which is shocking that things can change that quickly over a few years. So, and some long haul COVID patients are actually being diagnosed with mast cell activation syndrome, which is, I'm not saying it's good that people are getting diagnosed with it, but it's good that there's more awareness being brought to all of these illnesses.
Same with POTS.
Same with POTS, getting more funding for studies and everything and research is great. I hate that people have to deal with this because it's not fun, but at least we're getting some attention to it. And mast cell can be a very life-altering condition. And there's not a lot of information. We're still learning every day about it, and there still needs to be more research done. So if you are interested in this in any way, shape, or form, feel free to reach out to any of us, and also consider doing it as research as you guys go in your health professions or anything like that, because we need research on it, and maybe you can discover something new to help a lot of people. Does anyone have any questions at all for any of us?
Come on, there's got to be like one. No.
I wanted to let everyone know that, you know, at any level of degree of a mast cell disease, as long as you have a diagnosis, you can apply for a grant. And our grants, you know, they range anywhere from $500 to $2,000. We, you know, so all that information's on our website, supertmastcell.org. So again, next year when that window opens, you know, certainly apply. We have various grants that you can apply for. So look at the criteria, and if you meet it, you know, certainly apply. You know, that's what it's there for, to help.
Yeah, and with that too, if you guys are, some of you are pre-med, or just in general, if you need like volunteer hours, Super Teas is always looking for volunteers and to help coordinate things, or to be involved. So you guys already have met Tammy, so there's more great people involved too. And I'll just say, like, Super Teas has really changed my life. If it wasn't for Taylor, I'm not sure that I would have spoke out as much as I have, because I saw her do it. So even if it's not mast cell related and you're going through something, a lot of times it's easy just to shut down, not talk about it, but I really encourage you to find an outlet, and whatever your story is, share it, because honestly, there are more people going through similar things than you think, or even the same thing in a different way, or it's just really impactful, and it might not always seem like the thing you want to do, but there are so many benefits of sharing your story. So whether that's a mast cell disease, POTS, a chronic illness, your journey to becoming a physician, or being a college student, if you're in Chicago, what it's like living in the Midwest, whatever it is, whatever your thing is, I really encourage you to share your story.
I have to second that with what you said, Emma, because you know what, at the end of the day, taking that leap of faith to reach out to someone, making that connection, you never know where that connection's going to lead. So, you know, it's not always the easiest thing to be so vulnerable and, you know, just say, hey, you know, I don't know what the heck's going on, or how do I do this, or how did you do this, or how did you navigate that? Taking that step it's huge, because you know what, once you do that, then you realize your own strength and that you can do it, and making that connection, I'm a firm believer, you never know where that connection's going to lead.
Something that Tammy's been saying to us as long as I've known her is, even if you just impact one person and you inspire them in some way, shape, or form, it can impact a lot more people down the line. Everyone impacts someone else. So sharing your story could impact someone else, like it did, like Taylor's did for Emma. It could impact a physician down the line. I know some of my physicians haven't heard of mast cell before, and I gave them books on them, and now they're helping other people. So every small action has a reaction. So yeah, so thank you guys so much for joining us. If you have any questions at all, feel free to reach out to Taylor or Tammy or me or Sarah, or our IAL email address. But thank you guys so much for joining us, and we'll be sending out the recording in our next email.
Thank you,
Thanks.
everyone.
Yeah, thank you guys. Thanks for listening.
Thank you.